So I think it's very important for the community to discriminate between the cases that have occurred when people have been in isolation for the full period. So in terms of close contacts, we obviously test them on the way in, so we're assured that they're negative, and then we are expecting a proportion of close contacts to test a positive, and obviously household contacts, due to the nature of that intense contact, are more likely to transmit. And so what we've been seeing over recent days is actually somewhat pleasing, because if we had not identified those cases, they would have been out in the community with generating further exposure venues. The two cases that are demonstrate risk to the community are a young lady in her 20s who we believe, acquired the infection at Bondi Junction. She's a worker at Bondi Junction, and we believe that she was exposed again, probably through fleeting contact with one of the infectious people as they moved around Bondi Junction. So for this reason, we are calling out for anyone who has been in Bondi Junction, including the car parks, any time between the 12th of June and the 18th of June to get a test. Now, obviously, if you've been to one of the close contact venues, you should have been contacted about being in isolation for the 14 days, or the casual contact venue, check the specific advice. But if you don't have symptoms and you're just going forth because we're asking you to attend, you do not need to self-isolate, but we are asking you to minimise your contact with others until you have a negative test. And this is because we're casting the net very wide, because we want to pick up any of these inadvertent transmission. You can see how if we miss a case over the next cycle of 3 days to a week, we may have many cases coming from that single missed case. And so at the moment, we just want everyone to come forward and get tested. The other case that we're under investigation, and literally this test result came in a few hours ago, and we want to thank and acknowledge the cooperation of the St Charles Primary School for their cooperation. But can I again reiterate what the Premier has said? The school is working with health officials to develop a plan for the children to be discharged home to their parents, and we also want to provide advice and a mechanism to get testing, because obviously we want to find out how this child was exposed and establish that, because cases where we don't understand the acquisition mean that we've missed cases. And in this case, we don't have, on preliminary information, a source for this child's exposure. So we are looking for an intermediate source. So please, parents, I know that there may be a level of concern, but this is in hand. The school and public health will be communicating with you a safe plan for the students to go home, and also the testing arrangements, which are critical for us to understand this situation.